Hello, good evening. My name is Chris. I'm going to be your RN for today. And first of all, congratulations on giving birth successfully without any complications. I'm sure you're very happy, and we are all very happy for you too as well. But before you go home today, we just want to run through a few things just so that we can continue the success that you've had of your birth all the way into home. And before you go home, we just want to talk to you about a condition called postpartum preeclampsia. Okay, and this is something that we kind of discuss with postpartum patients, just as one of the things that we run down as a possible potential thing to look out for. Not to say that you have it, because we haven't seen those signs, but something that to be aware of. Okay, for the best health of you, and not just for your baby, but you as well, because we care about you too. So this preeclampsia that we're talking about, you told me earlier that you weren't very aware or um, heard about this condition, not so familiar. So basically what it is that it's a condition that can happen during pregnancy or after delivery. And today we're just going to focus on postpartum form, the postpartum preeclampsia, okay, which can develop after a baby is born, not just while you're pregnant. And really my goal today is just I want to explain what this condition is. I want to give you some warning signs to watch out for. Not scary, but just to be aware again. And when you should get medical help or seek medical attention, so you feel confident and safe once you're going back home. Just another piece of equipment to make you even more successful than you are with your birth. Okay, so postpartum preeclampsia is a condition where a patient develops high blood pressure. Okay, other changes in the body after delivery as well. Even if their blood pressure was normal during pregnancy, it most commonly happens within the first 48 hours after birth. However, it can occur, according to literature, up to 6 weeks postpartum. Okay, exact causes, if you may wonder, for postpartum preeclampsia, it's actually not fully understood or fully known. Some literature mentions it believed to be related to how the body responds to pregnancy and changes that happen after delivery, hormones, blood vessels, those sort of things. As you know, that pregnancy can change a lot of things in the body, as you are already knowing on your birth, your first birth. It's also important to know that this is not something that you caused. Okay, so I don't want to ever have those feelings. Well, maybe I caused something. Maybe I did something that caused that. It can happen to even after a healthy pregnancy. Okay, some people may actually though have higher risk of developing postpartum preeclampsia, and just including those who had preeclampsia during pregnancy, have a history of high blood pressure, are over the age of 35, have diabetes or kidney disease pre-existing, or carry excessive body weight. So it's going to be a higher BMI. Okay, so when you reach the BMI of obesity or being overweight, not you, but just in general population, that's when those risk factors start to increase. Okay, but this condition, okay, even if you might not have those, or a person may not have those, it can still happen without any known risk factors. And that's why important for everyone to know the warning signs. Okay, so once you're at home, there are certain symptoms you could watch out for closely. Okay, so remember, that's going to be after your birth all the way up to a certain amount of time that we mentioned earlier, 6 weeks postpartum. About you just want to watch how your body is changing, and this is going to include, one of the most important things is headache. Okay, specifically a headache that's very severe, does not go away with rest, fluids, Tylenol, and it feels different from your normal headache. Okay, headache that you may have never felt before, or this type of severity. So that's something you want to look at, especially if this headache comes with any blurred vision, you're seeing spots or dots, flashing lights, sensitivity to light. Those are some of the concerning warning signs. Should not ignore those. Okay, so some other things are blood pressure. Okay, you told me you have a blood pressure cuff at home, an automatic one. So please use that. It's a very important tool. Checking your blood pressure at home. You notice the readings, 140 over 90 or higher. right? 120 over 80, that's kind of where the normal is. Now, when you're reaching 20 over systolic, 140, and about 20 over on the, 10 over on the diastolic, that's according to literature. That's where you kind of have to monitor yourself, okay? Start talking to your PCP or primary OBGYN about that. Now, when it reaches a certain level, okay, we might consider this something that's urgent or emergency. Now, some literature says 160 over 110. We're starting to hover, going towards that direction, trending, or even higher than that. That's truly considered a hypertensive emergency that could be preeclamptic. Okay, so definitely, if you see those signs, you should seek medical care right away. Okay, some other warning signs to watch out for. All right, following. We'll ask questions after. Okay, I'll give an opportunity to you too as well. This is going to include swelling in the face, hands, or legs that suddenly worsen. Some things that are listed that are prepared for you is a pain in the upper right side of your abdomen, shortness of breath, nausea, vomiting. That does not improve. So any of those combination of symptoms. And these are not normal postpartum changes, if you may be wondering. Yeah, you might have some nausea, that sort of thing, but when you're starting to combine all of this hypertension, risk factors, and all this, you can start piecing it together and pointing towards a pattern towards abnormal or not normal, okay? And these may be the signs of postpartum preeclampsia. All right, so if this is not treated, it can lead to serious complications, okay? Seizures is one, okay? Clampic seizures, stroke, organ damage, fluid in the lungs, okay? A varying amount of things could happen. So it's very important to get recognizing these symptoms very early and getting treatment quickly. It's very important too. So if you do see these things, please contact your healthcare provider, okay, your primary OBGYN, seek emergency care. You can even come to this ER right away. Call an ambulance if needed. If you experience severe headache that does not go away, okay, right, again, vision changes, trouble breathing, chest pain, seizure, okay, that's a clampic now. Blood pressure readings higher than what your provider discussed or what we had just talked about. And if something feels wrong, okay, anything feels wrong, please just trust your instincts. Get help, seek your medical provider, reach out to him, even come to our ER. It's better to reach out for care, okay, for the providers to let you know that nothing's going on, for a clean bill of health. Very important. So trust those instincts, okay? So before we finish, I just want to make sure that I explain this clearly. I know there was a lot to discuss. A couple minutes of information, okay? Preeclampsia, postpartum preeclampsia. This is just one thing out of the many things that your providers and everyone's been talking about. Okay, but I just want to make sure that we've came across clear. So I just want to ask you, just kind of get an understanding if I taught clearly. Can you tell me one or two symptoms, perhaps, what would make you seek medical care right away or reach out to a medical provider? Okay. Can you also tell me what blood pressure numbers would make you call your provider or seek emergency care? Okay. Very good. Excellent. Thank you for your response. All right. So it sounds like we've covered everything. Do you have any other questions? Okay. Now, if you do, please don't hesitate to call the number that we have here. Call the provider. Okay. You can even call the office. Any questions? So please remember that you're not alone. So reaching out early makes a big difference. And please continue your success in your birth. You're a beautiful baby. And we hope things go well, not just here in the hospital, but also sending you back home too as well. Congratulations again, and thank you for taking time to talk with me today. All right.